The first step to any behavior therapy plan for a dog who is experiencing behavior concerns is management. Management plays a really vital role in any behavior therapy plan. The reason that it needs to come first is because part of what management does is it prevents all of your hard work from being undone by your dog's day-to-day interactions with those stressors. So if we don't have a management plan in place first, our behavior therapy plan is not going to be as effective or efficient. Management plans prevent negative associations from strengthening, and they prevent relationships from deteriorating. They also aim to keep everyone physically safe as well as feeling secure. And management plans prevent unwanted behaviors from being practiced, rehearsed, repeated, and reinforced. I always tell my clients that our management plans should be collaborative. There's a lot of blanket management guidance out there, which is not necessarily a bad thing, but it may need to be tweaked for certain circumstances, and what's helpful to one dog might actually be hurtful to another. The goal is to reduce stress and increase safety for everyone involved. Particularly when we're dealing with complex behavior cases of chronic nervous system dysregulation like trauma, hyperarousal, anxiety disorders, or chronic stress, we want to be sure that we are managing all of the stressors as much as we can, not just the ones that might feel the most salient to us, the human. Here are some common scenarios that need to be managed and some common management suggestions for those scenarios. Walks are a really common place where we want to put in some management. This is the case when we're seeing reactivity, or we have a dog who is hyper-aroused or otherwise distressed, anxious perhaps, on their walks. On walks, we probably want to avoid our triggers as much as possible. That can mean turning to go the other way, walking at off times, like in not so great weather or very early or very late in the day. It can mean seeking out places that are less populated to take our walks, such as lightly trafficked trails on all trails, sniff spots, other neighborhoods, quiet parks, cemeteries, green spaces, or ATV trails. We can come prepared with high-value treats on our walks to distract our dog to prevent them from seeing a trigger or to help them stay under threshold or at least lower on the stress scale when they see a trigger. We might also be able to use food to bring arousal down and help a dog recover from a stress event. That way they aren't stressed for as long. And there's less trigger stacking, which is when those stressors stack up to create one big stress response because they've been triggered so many times. A big part of management is knowing when your dog is feeling insecure, so paying close attention to their body language and their behavior is helpful. If we see signs of distress, like pinned ears, a furrowed brow, a tense, tight mouth, big eyes, lips pulled back long with little wrinkles here, a scooped tongue, panting from an elevated heart rate that's not related to the exercise or the heat, uneven weight distribution in the body, tension, hard staring, a low or tucked tail, a very high tail, a tail that's wagging really narrowly, an arched back, a curved spine. These might all be signs that your dog is not having a positive experience. And in those situations, we want to create space from the thing that is distressing them, and then help them come back down through activities that promote a physiological reduction of stress hormones like chewing, sniffing, and licking. Visitors are another really common place where we need management, sometimes because dogs are hyper-aroused, sometimes because they're frustrated, sometimes because they're scared, and sometimes because they're conflicted. Again, it's important to be able to recognize that we have stress here, so be on the lookout for things like a fidget response or a fawn response, which can be mistaken for soliciting affection, submissive behavior, overexcitement, but is actually distress. With management around visitors, we might be talking about confining the dog completely. We might be talking about just creating space, sometimes with physical barriers, or we might be talking about careful interaction. When we're talking about confinement, we're setting up the dog to not see or hear the visitors as much as possible and to physically be away. We might use closed doors, draping sheets, using window film to prevent visual triggering. And we might use things like white noise machines, pink, green, or brown noise, calming music, or box fans to prevent the dog from hearing. Sometimes using event medication is part of a management plan. And so for some dogs, we might use their prescribed event medication. We might set them up with a calming activity like a snuffle mat, a licky mat, or a chew. We might really work hard to make sure that their needs are satiated, their physical, emotional, social needs are satiated before the visitors come over. We might also have a situation where the dog can be in proximity but not interact with the visitor, and we can use things like X-pens, crates, gates, and leashes. It's really important to be able to tell when your dog wants more space and help facilitate that for them if they are on a leash or in a crate or otherwise can't move away without your support. We might see if the dog can take high-value treat from their safe person in the presence of the visitor. We never want to toss food towards the visitor or have the visitor hand food to the dog, because the dog might actually wind up in a situation that's not comfortable for them because they really want the food. Management for interacting with visitors might include things like muzzles for safety, properly conditioned, of course, so that the dog views it as a positive thing. And we might ask the human visitor to do things like toss food away from themselves behind the dog, so that while we're having the human give them treats, it's not done so in a way that creates social pressure or coercion and potentially puts the dog in a situation they're not ready to handle. And we might ensure that visitors don't touch the dog. Dogs with stranger danger really don't want to be petted by strangers, even if they're approaching. We might ask all our visitors to practice consent testing with our dogs if we do get to a point that we suspect the dog might want affection. Another really common space to need support for our dogs is management around their reactions and feelings to sights and sounds outside of the house from inside of the house. Here too is a place we might use window film or noise blocking to prevent reactions to the sights and sounds. We can sign up for text alerts for deliveries through the various places that do deliveries so that we have a heads up and can occupy our dog before a delivery comes. We might include a sign on the door that says, "Please no knocking, no soliciting." We might keep treat jars handy around the house so that if the dog does start reacting at the window or at the door, we can help them create space, call them away, and then engage them in something like a scatter feed so that they're coming back down from that stress response. Resource guarding is another place where we commonly need management. It's really normal for dogs to want space and the security that no one's going to take their item when they're enjoying it. We can allow dogs to enjoy their valued enrichment items with plenty of space and without being bothered. If we need to take something from them, we can ensure that we're always trading up for something better. And again here, body language and behavior are going to be really important to be able to read. If there is a situation where the dog is distressed and we can't put good management around it, we might prevent the dog from having access to that resource for the time being at least, while we figure out a safe way to let them enjoy that spot or that enrichment item or whatever they're guarding. Part of our management might also include changing how we respond to our dog's behavior. We want to eliminate the use of punishment and aversive experiences to our dog as much as possible because those have been shown to increase anxiety and aggression. So we want to do away with things like verbal corrections or yelling at the dog, any sort of physical punishment, including corrections on the leash or e-collars. There are tons of other spaces where we might need management. Distress at being left alone is a really common place. Management to decrease stress for vet visits and grooming appointments is another space. We might need management between pets in the home in the case of intra-household aggression, or we might need plans to defuse conflict in cases of family-directed aggression, or cases where the dog is distressed even if they're not responding aggressively. We might need management around car rides. We might need management around noises that are occurring inside of the home. Management might need to be increased when your dog has experienced a negative event and they're trigger stacked, they're still stressed out in the days that follow, or if they're feeling unwell, or they didn't get enough sleep. And your management will probably decrease as your dog gains new skills, as their emotions change, as they're better able to self-regulate, and as they become more resilient to stress.